Questions and answers about assessing blood pressure to determine hypertension.
Doctor, how to assess blood pressure to determine hypertension? Dr. Tran answers.
Hypertension is called hypertension when the pressure of blood pushing against the artery walls is always too high. Hypertension is determined based on multiple blood pressure readings and taken at different times to confirm the diagnosis. In some cases, additional testing may be needed to rule out causes of hypertension, such as kidney disease or thyroid disease. Blood pressure is measured in millimeters of mercury. According to the American Heart Association, hypertension is a blood pressure reading of 130/80 millimeters of mercury or higher. Hypertension has different levels. Each level of hypertension has different treatment indications. The American Heart Association divides blood pressure into 4 categories, and one emergency is called a hypertensive crisis. First is normal blood pressure, with an ideal blood pressure reading, when the systolic blood pressure is below 120 and the diastolic blood pressure is below 80 millimeters of mercury. Second is prehypertension, when the systolic blood pressure is between 120 and 129 and the diastolic blood pressure is below 80 millimeters of mercury. Third is stage 1 hypertension, when the systolic blood pressure is between 130 and 139 or the diastolic blood pressure is between 80 and 89 millimeters of mercury. Fourth is stage 2 hypertension, when the systolic blood pressure is 140 or higher or the diastolic blood pressure is 90 millimeters of mercury or higher. And fifth, when systolic blood pressure is higher than 180 millimeters of mercury and, or diastolic blood pressure is higher than 120 millimeters of mercury, it is considered a hypertensive crisis, which requires emergency treatment. There are a few important points to note. A single high blood pressure reading is not enough to diagnose hypertension. Hypertension is diagnosed based on the average of several blood pressure readings taken at separate times. This is because blood pressure can fluctuate naturally throughout the day due to many factors such as stress, exercise, and the types of food and drink consumed. Because of this, multiple readings are needed to establish a consistent pattern of elevated blood pressure, and to rule out any temporary spikes in blood pressure. A diagnosis of hypertension requires a consistently high blood pressure reading to confirm it. Approaching blood pressure requires a comprehensive approach to ensure accurate diagnosis and appropriate treatment. Controlling blood pressure is important because it can increase the risk of heart disease, stroke, and other serious health problems. Everyone should have their blood pressure checked at least every 2 years starting at age 18. Some people need it more often. Practicing a smoke-free lifestyle, exercising, and eating a healthy diet can help prevent and treat high blood pressure. Some people need to take medication to treat it.